primary muscles of the ventilation. Which muscles will help in primary ventilation? So here primary muscles of ventilation. First one, diaphragm. Diaphragm is the primary muscle of ventilation. After that, parasternal muscles. Last one, scalene muscles. Scalenes, okay, scalenes muscle. So these parasternal muscles here will be having two muscles, that is internal intercostal muscles and external intercostal muscles. So these are the parasternal muscles. Why these muscles are parasternal muscles means, suppose if we take, this is the manubrium of the sternum, this is the body of the sternum, and this is the xiphoid process of the sternum. Here will be having ribs, okay. So here inside will be having internal intercostal, on top of that will be having external intercostal. So these muscles are near to the sternum, so that's why these muscles are parasternal muscles. And here the point, diaphragm, parasternal, scalenes, all these muscles are going to helpful for the inspiration of the ventilation, and there is no muscle for the expiration, because expiration is a passive cycle. In the ventilation. Now we'll see the diaphragm. So if we take the diaphragm is the primary muscle of ventilation. Approximately 70% to 80% of the inspiration is carried out by the diaphragm muscle. So it is that important. So this diaphragm muscle is going to helpful in the quiet breathing. What it means, when we are in resting position, that time this diaphragm muscle is going to work. It's going to work most of the inspiratory cycle. So the diaphragm is a circular set of muscle fibers. The diaphragm is a circular set of muscle fibers. So it is not a single muscle fiber. It's like a circular set of the muscle fibers. Suppose if we take like this one circle, all the diaphragm muscle fibers will be like this. Okay, it is like a circular set of the muscle fibers. And where we can see this diaphragm, suppose if we take, these are our trunk. So here we will be having sternum. This is our rib cage. Okay. Rib cage. So the diaphragm muscle is going to present between the below the rib cage, and this is abdomen. This is thorax. So here it is going to differentiate. So here the diaphragm muscle is going to divide the entire trunk into thorax and abdomen. Because of this muscle only we will divide, this is thorax, this is abdomen. So it is a circular set of the muscle fibers. The circular set of muscle fibers arises from where these muscle fibers arises means, first one, sternum and ribs and vertebral bodies and costal cartilages. So from all these four bones, from all these four places, the diaphragm muscle will originate. Suppose this is our sternum, these are ribs. Okay, these are the ribs. Just imagine. Okay, these are the ribs. So here I am drawing, this is L1, L2, L3 vertebrae. Okay, L1, L2, L3 vertebrae. Here we will be having T12. If we go posteriorly, T11, T10, it will be like that. So it is going to start from the sternum. So here we will draw some fibers. So sternum. Okay, so from sternum, some fibers will come from the sternum. Some fibers will come from the ribs. At the same time, some fibers will come from the vertebral body. So L1 vertebra, L2 vertebra, L3 vertebral bodies. Some fibers will come from the costal cartilage. So the ribs are going to connect the costal cartilage here. So some fibers will come from here. So that here, see here, sternal portion will come. At the same time, ribs will be like this. No, ribs will be like this in this position. Ribs will be like this. So from the ribs some portion will come, and from the lumbar vertebra some portions will come. So all these portions, it is a circular set of muscle fibers. No, all these portions from these areas, the muscle will come. It is going to become like a circular. It is going to become like a circular shape. Okay, it will be like this. Diaphragm muscle will be like this circular shape. So it is going to form a central tendon. So all these muscle fibers will come into the center. The center, we can tell the tendon is a central tendon of the diaphragm muscle. Okay. And the innervation means blood supply. So innervation means nerve supply. So the innervation, it means nerve supply for this diaphragm muscle. It is coming from the right and left phrenic nerves. Okay, this is the nerve supply for the diaphragm muscle. And if you see blood supply, the blood supply is from the internal mammillary and internal costal and intercostal superior and inferior phrenic arteries. So this is the blood supply for the diaphragm muscle. Blood supply, internal mammillary artery and intercostal superior and inferior phrenic arteries. So this is the blood supply for the diaphragm muscle. And if you see diaphragm muscle functionally, till now we saw diaphragm muscle, it's like a anatomical circular shape. It will come from so many muscle fibers, circular shape muscle fibers, central tendon will form, that is anatomical. If you see functionally, the diaphragm muscle we can divide into two portions. The first portion is costal portion of the diaphragm muscle, and second portion is the crural portion crural portion of the diaphragm muscle. Coastal portion means it is going to give connection. It is mostly coastal means rib. No, coastal means rib. So that coastal portion, it is almost related to the ribs. It is almost related to the ribs. Now we'll see what is this coastal portion, what is this crural portion. Okay, functionally. Okay, functionally diaphragm we can divide into coastal portion. Okay, coastal portion and crural portion. In this, if we take coastal portion, so that here in this coastal portion, the diaphragm will be arising from the sternum, ribs, and coastal cartilage. So that here, if we take crural portion here, the diaphragm will be originating from the vertebral bodies. Understood? No, fine. If we see anatomically, the diaphragm is going to come from these four. Okay. If we see functionally, then we have to get coastal portion of the diaphragm from this area, and crural portion of the diaphragm will come from these areas. Okay. And here the crural portion of the diaphragm will come from the vertebral bodies. Which vertebral bodies means L1, L2, L3. So from these three vertebral bodies, this crural portion will come. Suppose if we see this coastal portion, it is coming from the sternum, ribs, coastal cartilage. No? Like simple example, if you see this is thoracic spine. This thoracic spine, here will be having ribs. So this is our sternum. So it is coming from the sternum. Okay, sternum will be there. It is coming from the sternum, and ribs will be there. Okay, see here sternal connection, then ribs connection, sternum, ribs, and here coastal cartilage will be there. No, so this is the coastal portion of the diaphragm. This is the coastal portion of the diaphragm. So here sternum, okay, done. Rib, here this is rib, okay. Coastal cartilage, here will be having coastal cartilage. Clear. This is coastal portion. If you see crural portion, this is our T12 vertebra. This is our L1, L2, and L3. Okay, L2, L3. Suppose here ribcage is ending here. Okay, this is the sternum. Ribcage is ending here. Just for understanding, here will be having coastal portion. This coastal portion I am drawing here. Here will be having coastal portion. Both sides coastal portion will be there, and crural portion it will come from L1, L2, L3. Okay, like this. Okay, L1, L2 like this. This is the crural portion. So it is going to make like a circle. So that's why diaphragm is the circular shape. It is like a circular shape. So this is the crural portion. Now we'll see action. How action will be. So this is very easy to understand. Action. Suppose here we are having ribcage. Here we are having ribcage. So these are our sternum. Here we are having ribs. Okay. These are all we are having ribs. Okay. Just imagine. Okay. Here we are having the diaphragm muscle. Here we are having the diaphragm muscle. This is our diaphragm muscle, and this is our abdomen. Okay. Abdomen. This is umbilicus. This is our inguinal ligament. Okay. Here. Now action. When the inspiration is happening, the diaphragm muscle fibers will contract concentrically. So once it contract concentrically, so the central tendon here will be having the central tendon. It will, when the diaphragm muscle is getting contraction, it is like a circular shape muscle. I told you, when it is contracting, the muscle will come down. It will be little. It is going to come down. What it means? The central tendon which is present here, it will descend. So when it descend, here what will happen in the thorax? The size of thorax will increase, because when the diaphragm was here, it was in some size. When it comes down after contracting, here some space is found. So because of that, the size of the thorax will increase. So when the size of the thorax is increased, it is going to increase the pleural pressure. What is this pleural? Pleural means it is the covering of the lungs. So the pleural pressure will increase. So causes a decrease in the intrapulmonary pressure. It is going to decrease the intrapulmonary pressure. So because of this, what will happen? The movements will happen like pump handle and bucket handle movements will happen in the ribs and sternum. Then finally we'll get the inspiration. Here. So here the point is, when the diaphragm muscle is contracting concentrically, it is going to pull down the central tendon, descend downward. So that size of the thorax will increase. The increased size of the thorax is going to increase the pleural pressure. The increased pleural pressure is going to decrease the intrapulmonary pressure. So that because of these things, we'll get this pump handle, bucket handle movements in the ribs and sternum. Then patient will get the movement inspiration. Okay. This is about the action of the diaphragm in this inspiration, right? Ventilation. So here one special point to understand. This is okay. Inspiration will get over. Okay. Then when the diaphragm is coming down, it is going to give a kind of pressure in the abdomen. In the abdomen. So here it will give pressure in the abdomen. The intra-abdominal pressure will increase. The intra-abdominal pressure is going to shift to the lateral side. Because of the shift of the pressure to lateral side, the lateral side shifted pressure is going to move the lower ribs. It is going to move the like this. The pressure which is coming down in the abdomen. This from abdomen, it will shift to the lateral sides of the body. From here, the lower ribcage which is present here, it will move outward. So that here transverse diameter of the ribcage will increase. So this is the bucket handle movement of the lower ribs. So this is how the diaphragm is going to be helpful in the ventilation. Intercostal muscles. These are the second. First one is a diaphragm. First one is the diaphragm as the primary muscle of the ventilation. Second muscle is the intercostal muscles. In these intercostal muscles, we know that intercostal muscles are present between the two ribs. Suppose here this is our ribs, these are our ribs. Here we are having sternum, here we are having sternum. So this one rib, this is one rib. The muscles which are present between the ribs are called as the intercostal muscles. Okay, and here the intercostal muscles will be having two intercostal muscles. First one internal intercostal muscle and external intercostal muscles. Both we are having internal and external costal muscles. Suppose if we take internal intercostal muscle, how it will be? Suppose this is our one rib. Okay, this is one rib. Imagine this is one rib, and here downward we will be having one more rib. So this is one more rib. This is one more rib. So just imagine the internal intercostal muscles. First one, internal intercostal muscles. These internal intercostal muscles begins anteriorly. Suppose if this is the sternum, Here, if I process, this is mandibular sternum. These are our ribs. No, these are our ribs. So what is this internal intercostal muscles? Internal intercostal muscles start in the anterior. So these muscles will start in the anteriorly, and at the same time, the internal intercostal arises from the ridge of the inner surface of the first rib to the 12th rib, first rib to the 11th rib. So that here these muscles are going to start from the ridge of the vertebra, ridge of the rib. These muscles are going to start from the ridge of the ribs from first rib to 11th rib. It will start, and the orientation. So the orientation, the fibers of the internal intercostals, insert on the superior border of the rib below. So the fibers which are all muscles will come from here, mean internal intercostal. It will insert on the superior border of the inferior rib, otherwise below rib. So imagine here we are having sternum. Okay, here we are having sternum. So the internal intercostal muscles are going to start at the ridge of the superior vertebra, and the muscle which will insert into the superior surface of the inferior rib are down, mean the rib which is below to this rib. Okay, how the orientation will be, the fiber orientation, the fibers will run downward and posterior. The fibers of the internal intercostals will run downward and posterior. This is the fiber orientation for the internal intercostal muscles. Suppose if we take external intercostal muscles, in this external intercostal muscles, it will start from the inferior portion of the rib, and it will insert on the superior portion of the rib below to this rib. So that here also external intercostal muscles, first rib to 11th rib will be having external intercostal muscles. So the fiber orientation will be the external intercostal fibers runs downward and oblique. See that it runs downward and oblique. So this is the only variation we should understand. Suppose if you take the rib case, first internal intercostal muscle will be there. On top of that, first internal intercostal muscle will be there. On top of that, external intercostal muscle will come. So internal intercostal muscle fiber orientation downward and posterior. External intercostal muscle orientation is downward and oblique. So this is the orientation of the external and internal intercostal muscles. And one more point about internal intercostal muscles. These internal intercostal muscles are going to start anteriorly. Imagine this is the sternum, this is posterior vertebra. Suppose this is our sternum. So internal intercostal muscles are going to start in the anteriorly, and they will cross over the rib cage, and at the posterior, these internal intercostal muscles will become the posterior intercostal membrane. So that anteriorly one layer of muscles will be there. Those muscles are the internal intercostal muscles. They will be present anteriorly, and they will come to the lateral, and at the same time posteriorly these muscles will become posterior intercostal membrane. Okay, now we will see external intercostal muscles. If we see external intercostal muscles, these muscles are going to start at the posteriorly. Then it will run through the curve of the rib. And here anteriorly these external intercostal muscles will become anterior intercostal membrane. So here the point is, if we see anteriorly, only internal intercostal muscles will be present. If we see posteriorly, only external intercostal muscles will be present. If we see the curvatures of the ribs, here we will be having both, mean laterally internal intercostal muscles, both internal intercostal muscles and external intercostal muscles. Okay, external intercostal muscles. So the muscle which is present anteriorly to the sternum, that is internal intercostal muscles. These muscles are called as the parasternal muscles. So these internal intercostal muscles are the primary, these are the main, most important inspiratory muscles in the intercostal muscles. Okay, now we'll see overall action of this. And one more point, here we saw both internal intercostal muscles will be there and external intercostal muscles will be there. So together these muscles in the lateral curvature of the rib, we will call these muscles as interosseous or lateral intercostals. See, interosseous muscles or lateral intercostals. So this is the name for these muscles. Okay, now we'll see overall how the muscles are going to helpful in inspiration and expiration. If we come to action, first one external intercostal muscles, second one internal intercostal muscles, and third one we have interosseous muscles, also called as the lateral intercostals. Okay, so if we see the action of these muscles, it's like a little controversy. That means it's not proper. So one theory is saying that suppose if we take a rib cage, so the external intercostal muscles are going to elevate the rib cage. So that means the external intercostal muscles are going to helpful for the inspiration by elevating the rib cage, and at the same time internal intercostal muscles are can produce the downward movement of the rib cage. So that means it is going to helpful in the expiration. It is going to helpful in the expiration of the rib cage. Suppose recently, now previously we discussed this internal intercostal muscles also called as the parasternal muscles. Some of the theories are saying that these parasternal, internal intercostal muscles are the primary, these are going to helpful in the inspiration. Movement. Okay, so that's what it is, little controversial. Whatever. These parasternal muscles, okay, inspiration, okay, chodo. Here one theory is saying like it will help in expiration, okay. And apart from this, the primary function means one more function of this internal intercostal muscles is to provide stability to the sternum and ribs. This is also one important function for this internal intercostal muscles. And one more point, this internal intercostal muscles is work most commonly in quiet breathing. Quiet breathing means when we are in resting time, that time this muscle is going to work more to do inspiration. So this some points. And one more point, here when we are doing inspiration or expiration, here we need both external intercostal muscles we require plus internal intercostal muscles action we require. Suppose if we are doing any activity or exercise, that time this both muscles, and at the same time some extra muscles are going to work with these muscles to provide the ventilation. And one more point here, if you see, this is upper portion of the rib cage, this is lower portion of the rib cage. So in this lower portion, the intercostal muscles which are present, either internal intercostal or external intercostal muscles, these muscles are not going to involve in the quiet breathing. Quiet means like resting. If you are doing any exercise or physical activity or deep breathing exercise, that time the lower portion of the intercostal muscles will activate. And if you see, interstitials are lateral intercostal muscles. These muscles, the portion of these muscles, these are mostly helpful in the rotation. Rotation of the rib cage. Simply we can say like thoracic cage, rotation or thoracic side flexion and rotation. These muscles are going to helpful in this movement. So these about the intercostal muscles. And this about the scalenus muscles. These muscles are also primary muscles of the ventilation. These muscles are going to start from the transverse process of C3 to C7 cervical vertebra. So these muscles are going to start from the transverse processes of C3, C4, C5, C6 and C7, and after that these are going to insert on the first rib. So in this first rib they are going to insert, where they are going to insert anteriorly. This is anterior scalene muscles. This is going to attach medially. So these are middle scalene muscles. Some fibers will attach posteriorly on the second rib. So these are the posterior scalene muscles. So that here scalene muscles we are having anterior scalene, middle scalene. So these anterior and medius or middle scalene muscles are attached to the first rib, and to the second rib these scalene muscles will attach to the second rib posteriorly, so that these portions are posterior scalene muscles. And if we come to the action of these scalene muscles, imagine this mandible, this sternum, okay. So here I didn't draw thoracic spine, okay, just to understand easily, okay. If we come to action of these scalene muscles, the scalene muscles activity begins at the onset of inspiration. As inspiration gets closer to the lung capacity, okay. So the activity of the skeletal muscle will start at the inspiration. It will start when inspiration is starting, that time the action of the skeletal muscle will start, and the skeletal muscle action will increase. When how it will increase means until inspiration gets closer to the total lung capacity. And what kind of action this will do means, so here these muscles are inserting into the first rib and second rib, so that here skeletal muscle can elevate the first rib and second rib. So if first rib and second rib are elevating, automatically these two ribs are connected to the sternum, so that here sternum also will elevate. How it will elevate means upward elevation and forward movement. So this is nothing but the pump handle movement, so that here skeletal muscles are going to respond for the production of the pump handle movement in the upper two ribs, so that it is going to helpful in the inspiration, right? And one more point, these skeletal muscles are also a part of the stabilization of the rib cage. So that means not only inspiration, these skeletal muscles are going to provide stabilization to the rib cage.